It was interesting, even on the fellowship end, there was similar things. Some programs had not virtual dinners the night before, but they would send you, like swag bags or goodie bags, or they would send you, like virtual gift cards so that you could order your own lunch and kind of eat lunch during the, halfway point of the interview day to sort of mimic what that experience would be like. It was a nice touch. I wasn't expecting any of that.
I was just going to ask you, because that has come up as a discussion. Now, programs are limited in the amount of money that they can put into each swag bag so that no one has a competitive advantage. And it has come up for discussion whether we should allow swag bags again this year, whether applicants like them or not. So I'm curious your thought whether
this is just in ophthalmology or across
just
the
in
board?
Ophthalmology.
Who voiced this initially, or were there multiple programs who felt like they didn't put their best competitive advertising forward?
I will not divulge the people who have raised this as an issue, but it is percolated up to the people who make the decisions as to whether the swag bags are a good idea or undue influence or unnecessary. Well, they're certainly not necessary, but when you can't visit a program.
When I was interviewing for residency and it was all in person, there was still a very stark difference in terms of what programs gave you. Some programs gave you coffee mugs. They gave you like actual tote bags. They gave you lookbooks. They gave you flash drives. So there was never anything standardized. And it sounds like there was never some sort of formal budget cap before either.
I don't think there was before. And, this year we had standardized keeping track of the number of interview positions too. So things are a little more centralized.
I certainly took note when a program went all out and provided more of a swag bag type experience than other ones. I mean, it was a nice gesture, but it never factored into, that's not something I can't imagine any residency applicant is going to base their decision off of. So I can certainly understand the desire to want to standardize anything, but I don't think anyone made any residency decisions based off of some program had a $30 lunch versus another program which had a $10 lunch. You could probably read into that if you're a residency applicant and try to project, if you don't know much about a program, what that means. But that's probably reading into it a little bit too much.